My name is Dr. David Forshaw. I'm a board-certified neurosurgeon. I'm a member of NOS, Neurosurgery, Orthopedic, and Spine Specialists. NOS is a private practice, multi-specialty group. We treat patients in the community for going on 40 plus years here. What we do is we partner with certain hospitals to provide high quality, compassionate local care. And St. Mary's is one of our partners. Cervical spine surgery is performing operations on people's cervical spine or their necks. The cervical spine is at the top of the spinal column. This is different from lumbar spine because in this area we deal with the spinal cord. The spinal cord is the highway for information to get from the brain to patients' arms and legs. So, when patients have cervical spine issues, they can present with multiple problems. They can present with numbness, tingling, weakness in their upper or lower extremities. They can present with neck pain or significant problems with even such simple things as walking around. So when patients have spinal cord compression or nerve root compression, they might need an operation to decompress those critical structures. So patients who might require cervical spine surgery have again gone through conservative therapies. They might do some physical therapy, some medications, some injections. Or if their neurologic problems are so severe, they might require more aggressive surgery. In terms of approaching the cervical spine, there are two main ways we come at the cervical spine. One is from the front of the neck through an anterior approach. That surgery is called an anterior cervical discectomy and fusion, ACDF. What that surgery entails is a small cut in the patient's neck. We then move the breathing tube and feeding tube out of the way and move the carotid artery to the other side. It's like opening up curtains. That brings us to the front of the spine where we can safely remove the disc, take the pressure off the spinal cord and nerves, place a small device to hold that space open, and a small plate to hold it all together. Another option for patients, if they don't require a fusion, is to do a motion-sparing procedure, a cervical arthroplasty, or an artificial disc. What that does is preserves the patient's range of motion while still accomplishing the goals of decompressing the spinal cord and nerves. So when patients have cervical spine surgery, there can be a varied recovery from that surgery. One, it depends on the type of surgery done. Two, on what the pathology was pre-surgery. Patients who have a 1 or 2 level anterior surgery typically go home the same day. They have a sore throat, they have a stiff neck, they might have a hoarse voice from moving around those critical structures. They typically have a little difficulty swallowing, all normal. It all does resolve as well. Patients then, from taking the pressure off the nerves and the spinal cord, go on to, in general, have a very good recovery from this type of surgery. So we have worked with St. Mary's Hospital very closely over the years in order to get external markers of our excellence. Some of these have been through the Joint Commission Accreditation for Spine Surgery, another which is the Blue Cross Insurance Company's Center of Distinction. So outside, independent, third parties have verified the hard work we do in order to assure that our patients get the best possible care here in the community.